Good morning and welcome to another edition of the Safety Net series. This is our third year talking with our partner agencies and all the wonderful things that they've got going on in the community. Today we've got Kim with Victory Health Partners joining us. Real quickly before we jump on with her, we want to thank our sponsors. They are great supporters and really make a lot of the work that we do possible, and we are grateful for their support. So we'll get right to Kim. Hey, Kim.
Hi, how are you?
I'm well. Thank you so much for joining us this morning.
Of course.
So I feel like a lot of people are really getting to know who you guys are, but for that minority of folks out there, tell us about what Victory is and what it does for the community.
Yes, absolutely. And that has always been a struggle, is people knowing about us and people saying, oh, you're the best kept secret, which is not what we want. That's not good marketing. So Victory is a faith-based nonprofit medical practice, and we take care of one group of patients. That's low to moderate income adults who don't have health insurance. So I think there's a misconception that everyone has health insurance, and if you've never gone without it, it's something that you just don't really think of. But there's about 13% of our community that does not have access to health care because they don't have health insurance. They don't have an affordable, accessible option to get those preventative, those continuous medications, checkups, just everything that a lot of us take for granted. And it's just so expensive. And there's just that gap of people who make a little bit too much to qualify for Medicaid, not enough to qualify for Medicare, and they don't get the employer-sponsored health benefits. They might be working part-time. They might work for a small business. They might own a small business. There's so many people who fall within the gap, and that's who Victory serves. And we started over 20 years ago. Our founder, Dr. Lightfoot, stepped away from a successful surgery practice because him and his wife and a group of individuals knew that there was a need, and that was really what the healthcare community identified. They said, we need help with this group of patients. And so throughout the last 20 years, different partners have come around, from optometrists to counselors to neurologists to other internal medicine providers and physicians. So many volunteers. It truly is a community solution for a community problem. And that name, Partners, was perfectly placed in our name because Dr. Lightfoot knew that he could not do it himself. He needed the support of our donors and our volunteers, our dentists, our about 150 to 200 specialists who will see our patients either at our office or we can refer them out. And that is, that's healthcare. That's access to healthcare that's life-saving, life transforming. We have patients who walk in who need help with their diabetes, who need help with their hypertension, who have chronic kind of ongoing diseases that they need access to a doctor and medication. Maybe they got hurt on the job and they need to go see an orthopedic surgeon, or they walk in and they have a cancer diagnosis, or they're struggling with depression and anxiety. That is such a huge need right now. But what do those patients do? If they don't have access to a doctor, a lot of times they will wait until they're so sick or they're in this crisis state to where it's become an emergency, and they have to utilize a hospital ER, which is the last place you need to go because it's not its purpose. That's for emergencies. But what happens is they'll wait till they are so sick, which is what anyone would have to do, and then they go see a doctor at the ER. They get tests that they're not able to pay for. They get maybe a sample dosage of medication, but where do they go when they need to get the refill? Where do they need to go to get the follow-up? So just this continuous cycle to where someone without insurance, just because they don't have that access, has a 40% greater chance of death from someone who has that insurance card. So that's what we do. And we started with 12 patients on our first day. We've grown to serve over 40,000 adults. And while we're located in Mobile, we have patients coming for access to healthcare from 25 counties in Alabama, 11 in Mississippi, and 8 in Florida. So they can see their doctor, they can get their medicine for free, they can see the counselor, they can see a specialist. We partnered up with one of our great other partner agencies, Feeding the Gulf Coast. Patients can get access to healthy, nutritious food on their way out. So try to be a full integrated kind of continuum of care for our patients. I know that was a lot, and I can keep going, but I'll pause.
And then I do want to kind of circle back, and you touched on it there at the end. but you guys really have like a holistic approach, as you mentioned, mental health, physical health, and then you guys have a spiritual health component too. Talk a little bit about
That's
your
right. That's right.
holistic
We feel like
approach.
by addressing the full, let's see, are we good?
Yeah. Sorry,
Okay.
it jumps out sometimes.
No, we feel like if we're not addressing the whole patient, then we're really not caring the way that we feel like we should, that we're called to. So caring obviously for their physical needs, meeting them right where they are with that. Mental health. We all know that affects everything. I mean, that's just as important as your physical health. So having access to counselors, to psychiatrists, mental health is provided for free for our patients. So whether you're coming to see the counselor, you're coming in to see our psychiatrist, that's all at no charge because we don't want any barriers to receiving that mental health. Providing food and nutrition, what we put in our bodies is, it's just as important as what we, put in our minds and what we put in for medications and other things. And of course, our spiritual health. So many things can go back to being a spiritual issue. So we feel like by connecting all those together and caring for our patients, we're appointment based. Typically, patients can get in, if they need to get in that day or that week, we can do that. And we want to see as many patients as we can, but we also recognize that if a patient needs to spend 30 minutes with a doctor, that's what they need to do. If they need to spend, if it's just a quick checkup, if in and out, then that's great. But to be able to really spend time with our patients so that, they're not a time slot, they're not a number. We know
Mm.
to really sit and listen, because it could be something through the appointment that our doctors here. It could be that you're struggling with anxiety. That could be maybe why you're feeling this way, or hey, your lab panels came back fine, but you're telling me about your husband just lost his job and you're having this issue with, a hard time with your child. Maybe there might be something else. Would you like to talk to our counselor? But those quick appointments, we might miss it. So having that time to really sit and listen, especially with someone who might have not ever seen a doctor or really had time to sit with a doctor, that's the model that we have at Victory, and we think it's excellent healthcare that our patients are able to receive.
So, what it's getting into summertime. What, if anything, do you guys have coming up? Or if you want to talk about your big thing that you have in the spring, we could talk about that too. What's coming
Yes.
up that you want folks to know about?
Oh gosh, so we just wrapped up our Hope for Healing. So next year will be April, I think 30th. I have to look and see. We already have our date for next year, but that is our biggest fundraiser. We also have a golf tournament Piggly Wiggly does for us. That's in the spring too. Springtime is heavy for our fundraisers, just like seems like everybody else. So we had John Smoltz this year, which was so fun. We're working on next year's speakers. So every year, always looking to bring a wonderful event for Victory in Mobile. But just as people are, they're traveling, thinking about going back to school, just to still be mindful of your health. I know we're all feeling the crunch of the economy, and also people wanting to go on vacations and get ready for back to school and everything, but not to delay your health care. If you have something going on, if you're without insurance, don't wait. Come on in. For all new patient appointments, that first appointment is free. So to come in and get established at Victory is no cost at all. But just to stay with your health care. It can be hard with kids being out of school, with getting ready. I know August will be here before we know it, but just to stay with your health care. And I know there are some companies who are looking at their budgets and seeing like, my goodness, everything is going up right now. Let Victory be a resource to come in and talk to your employees about health, about wellness, about if you have part-time workers who don't qualify for your health insurance or they decide not to opt in, to reach out to us, that we can be there as a resource to help keep your workforce healthy and well. But just to be mindful that we all keep taking care of it ourselves and not delaying. But yeah, but there's always different events and things that pop up. Social media is a great tool to keep on track with Victory. But our doors are always open if people want to come take a tour, to learn more, whether it's to volunteer, to support, for us to be a resource for their employees, definitely reach out. We would love to share the impact, kind of like what I said earlier, of what happens when a community comes around to address a need in the community.
So you mentioned volunteers. Now I know that a lot of your doctors and nurses and like those highly skilled professional um, medical caregivers are volunteers.
Mhm.
And like, do you have regular people
Yes,
volunteer opportunities that
we take
help
everybody.
have those really specialized skills but want to be
Mhm.
involved?
I am the most non-medical person there. I can apply a Band-Aid and that's it. Yeah, absolutely. Even if it's companies that want to do a food drive, maybe it's they want to do something internal where they can do a food drive or a supply drive for Victory. Or, we always have for events, we have companies that will come and do event support for us. There's always something with development. There's things working up at the front. Things with ordering patients are their medications. Last year we ordered $65 million worth of free medications to patients. That is a whole lot. We have one staff member who does that. So she is always needing volunteers. And that's just, basic administrative work. So we're always looking for opportunities there. But, whenever someone comes to us and says they want to volunteer, we want to find out what would be meaningful for them and certainly plug them in the right spot so that not only is it a blessing to us, but certainly a blessing to them.
Right. Well, any final thoughts as we wrap up this morning?
No, I mean, we've been a partner agency for, gosh, a long time. And we're so grateful. It's such a meaningful partnership. And truly it is a partnership because not only is the financial support equips us to do what we need to do, but it's opportunities like this where we can possibly reach a new partner, a new patient, someone who might be in need listening right now. But then also we have this whole network of partners. I mentioned partnering with Feeding the Gulf Coast. Why should I redevelop the wheel when we have them right there? When we partner with Lifelines for different counseling services, or other agencies partner with us where we're able to see, clients from Sybil Smith or Penelope House or other agencies, whether it's their clients they serve or their staff members. We want to be a good partner, and it's been such a joy to partner alongside United Way. So as the community supports Victory supports another agency, they're touching so many because so many of my patients also utilize other services.
Yeah.
So we're grateful to be a partner, and yeah, thank you, Leslie, for everything you do.
Well, we appreciate it, and it really is. It's so important because that the way that all of the partners fit together and to make the community safety net. So thank you for being a part of that and being such a strong member. As we close out, I'm going to bring up the actual list of our sponsors, so you can take a look and see all of the wonderful companies who have helped support these broadcasts and other events throughout the year. And so we will look forward to seeing you guys next week. Thanks again, Kim, and y'all have a great rest of your day.
Thank you.